Dr. Asmita.
Thank you, Suma ma'am, for making me part of this IC. So I'll be talking on etiology and pathogenesis of cerebral visual impairment in children. Cerebral visual impairment is defined as a complex form of vision loss resulting from damage to the retrochiasmal visual pathways, which includes the optic radiation and visual cortex, and pathways serving higher visual functions. It may be isolated or may accompany anterior visual pathway dysfunction. In some cases, this is compounded by a disordered eye movement control. Now, coming to the epidemiology, it is one of the leading causes of visual impairment due to increased survival of preterm babies and better neonatal care. Successful management of childhood causes of blindness due to congenital cataract and retinopathy of prematurity and increased survival of children with brain injury has resulted in rise in such cases. Now, coming to the main topic, etiology of CVI. Broadly can be classified as perinatal causes, which includes hypoxic ischemic encephalopathy in preterm neonates, or PVL, periventricular leukomalacia. It occurs due to vulnerability of the immature brain blood vessels in the watershed zones, which is the germinal matrix, adjacent to the ventricles and in close proximity to the optic radiations. It leads to low blood flow, focal tissue death, and injury to the immature glial brain cells and additional inflammation. So this is an MRI scan of a child showing cerebral visual impairment where there is expansion of the lateral ventricles and periventricular leukomalacia. Next is hypoxic ischemic encephalopathy in term infants, which happens due to brain injury following cord prolapse or asphyxia. It occurs in the areas of distribution of basically the cerebral arteries and their watershed zones. Germinal matrix regresses by 32 weeks, so here periventricular white matter is spared. Prognosis is better in such cases. Also, involvement of the basal ganglia and hippocampus following birth asphyxia have been seen in some patients. This is a MRI scan showing a posterior cerebral artery infarct involving the occipital area. Next is traumatic brain injury in children. Why is it common in children? Because they have flexible skulls, relatively less CSF volume, and reduced distance between the cortex and cranium. It occurs due to transient ischemia or edema due to the shearing of nerve axons. The next is hydrocephalus. We all know it. Their expansion of the lateral ventricle happens. Herniation of the brain tissues to the tentorial orifice, compromising the blood flow of posterior cerebral arteries, and thereby it causes bilateral occipital infarction and vision loss. Infections of the central nervous system also contribute to CVI. Combined meningitis and encephalitis is the commonest cause. In utero infections like CMV, toxoplasmosis, rubella, and herpes also contribute to it. And bacterial meningitis always has poorer prognosis than the viral one. Neonatal hypoglycemia and other metabolic disorders have also been seen to be associated with CVI. Severe hypoglycemia causes CVI due to injury to the visual or posterior parietal cortex. Mitochondrial, lysosomal, and paroxysmal disorders also causes visual impairment. Uncontrolled seizure disorder. We all know that CVI is very common in children with infantile spasm, especially in hypothermic electroencephalograms. Another interesting point is twin pregnancy, especially in twin-twin transfusion syndrome. Here, the larger baby most of the time is seen to have been affected by CVI. Why does it happen? Because the larger twin adversely is affected due to expanded blood volume and results in vascular stress. Also, certain cranial nerve system developmental defects like lesioncephaly, holoprosencephaly, and senescephaly have been seen to be associated with CVI. And like all other things, maternal intake of drugs during pregnancy also results in CVI. Methadone, opium, benzodiazepines, cocaine, and alcohol adversely affect the visual system, causing infarction of key neurological structures. And lastly, acquired causes in late childhood like respiratory arrest, head injury, cardiac surgery complications, and cardiac arrest. This leads to brain blood vessel damage, which ultimately can cause CVI. However, in some cases, these are seen to be transient. Now, what is exactly CVI? What happens in CVI? Pathogenesis of CVI is related to disorders of higher visual functions in presence of normal ocular examination. The higher visual function consists of two distinct but interacting pathways. Now, what are these? One is the perceptual pathway or ventral stream, and the other is the action pathway or the dorsal stream. Now, what is this ventral stream and dorsal stream? Ventral stream basically connects the occipital cortex to the inferior temporal cortex. It stands for the visual library or what pathway of the brain. Prior memories of objects and people are stored and coordinated here. The dorsal stream, it connects the occipital, parietal, frontal, and motor cortex. It stands for the visual map or visual space or wear pathway of the brain. It helps to coordinate hand-eye movements on looking at a target object. So if you grossly see this picture, here this is the dorsal stream which connects the occipital lobe to the parietal lobe, which goes to the frontal lobe and motor cortex. This comprises the dorsal visual stream, which stands for the wear pathway, like the visual mapping system, and the ventral pathway consists of the occipital lobe and the temporal lobe, or the what pathway. This is where the memories are stored. The dorsal stream is the most integrating part. Why so? Because the visual scene is first processed in the occipital cortex, then the dorsal stream conveys this data set to the posterior parietal cortex where the scene is processed. Once the scene is selected, information is passed to the frontal lobe, which instructs head and eyes to look at an object scene. And lastly, coordinates of objects are passed to the motor cortex, which brings about coordinated hand-eye movements to reach the object. So it's a very complex system brought about so beautifully in our brain. So this is a tree of vision. We can see where the visual scene from both the eyes passes via the retina-optic nerves, optic tracts, via the lateral geniculate body optic radiations, passes on to the occipital lobe, from where it relays to the temporal and the posterior parietal lobes, where we can see a complex yet such unique and defined system by which we see an object and we respond to it. Now, what happens when this system goes haywire? This is where CVI happens. So this is ventral stream dysfunction and dorsal stream dysfunction. What happens? As the ventral stream stands for the memory of the brain, we first notice is prosopagnosia or impaired face recognition. There is topographic agnosia or difficult route finding or navigation, and there is impaired recognition of objects, shapes, and letters. The dorsal stream function is more related with the visual mapping, so we get optic ataxia or impaired visual guidance, limited capacity for simultaneous viewing of multiple objects at once, and lack of visual perception and coordination. So these are some of the common things we see in dorsal stream dysfunction. There is inability to find toys from a toy box. A child gets confused from where to pick which toy. Then difficulty in judging depth. You can see the child is lifting the legs way beyond up. Then there is difficulty in grasping and judging distance of objects from the body. This is very common we see in CVI children, that difficulty in climbing stairs, because in most cases we see that there is a inferior field defect which results in this. Then there is difficulty in seeing very small prints or images. And as the ventral stream dysfunction is more related with memory, so it results in integrative agnosia of faces, places, objects, and shapes. Thus, to conclude, we can say that cerebral visual impairment is obvious when there is a profound problem in vision, but is more difficult to detect when visual acuity is relatively normal. Thus, proper knowledge or awareness regarding etiology and pathogenesis of cerebral visual impairment can help us in early detection of the condition using accurate diagnostic tools like MRI, electrophysiological test, etc., and thereby help in early intervention and rehabilitation of such special children. Thank you.
Excellent presentation. I think we all see such children in OPD, and it is important for us to diagnose them early, because what we have find is that most of the time we are saying, okay, the vision is 6-12, we keep on working up ophthalmologically, and we are not finding out what is the functional vision deficits the child has. So it is very, very crucial for us to detect them early and treat. So now Dr. Sobita Rath will be telling us how to detect them early, the ophthalmic manifestations and assessments.